Over the last 7 years, we've spoken to thousands of people about what helps them to keep well and living life to the full. After a while, we started to notice some patterns, and that no matter what their health issues, age, or where they lived, people told us the same things. It all boiled down to five positive emotions. We call this the emotional currency of health and care. And what we have learnt is that the health and care system trades in this emotional currency, often unconsciously. Let's look at each emotion in turn. The first emotion is hope. We first learnt about hope from talking to people living with long term mental health issues. Since then, we've understood that hope matters to most people. For instance, those living with long term conditions tell us that the biggest impact of a second or third diagnosis is that it shatters hope. When we design services that build hope, we raise expectations about how good life can be and improve well-being. The second emotion is understanding. Often those working in health and care systems use words like compassion, empathy, or personalisation. People and families say things like, I wish they understood me. I'm a person and I have a life outside of here. I'm not my health condition. People want to be seen and understood by health and caregivers. They want to know that what matters to them matters to those supporting them to keep well. Research shows that setting personal outcomes together changes the conversation and builds hope. Working towards shared goals also cements a positive relationship, something that matters universally to people and families. The third emotion is trust. When a person trusts the professionals caring for them, they feel reassured and safe. Trust grows from continuity of care and from feeling understood. When people fail to build trust with professionals, they keep coming back and circumventing the system until they find someone they do trust. Trust can be easily broken. When trust goes, people lose trust in the whole system. In discovery work we did with those who frequently go to see their GP, we found that a common experience for many was that they or a member of their family had experienced a poor outcome of care. Once they lost trust in the system, they kept coming back to their GP. Relationships are often undervalued in the design of health and care systems. Building continuity and relationship-centred care, including proactive follow-up, is key. Reassurance is the fourth emotion. Reassurance is the most important element of emotional currency in the NHS. Most of the time, people are seeking reassurance. Those who live with complex care needs value swift access to reassurance when something unexpected happens, especially if they live with a condition exacerbated by anxiety. Quick access to reassurance stops that anxiety escalating and causing breathlessness that sees them admitted to hospital. Parents of young children, especially first-time mums, need lots of reassurance, which is why they may be frequent visitors at GP surgeries and value health visitors who they know being on the end of the phone. Reassurance services need to be a big focus of all transformation programmes and of urgent care. The fifth emotion is happiness. Research shows that happy people most often have an abundance of two things in their lives: things that bring them pleasure and things that give them a sense of meaning. Social connection is usually important to achieving both. When people set goals, they are nearly always about creating happiness. The evidence we've generated over 7 years suggests that if we design services that build a positive legacy of these five emotions, and contracts recognise and trade in an emotional as well as a financial currency, we will achieve transformation. Regardless of the local care model, communities in partnership with someone in the system need to set outcomes, and communities in partnership with someone need to be accountable for delivering improvement in those outcomes. Whoever that is in your system needs to understand the power of emotional currency and measure whether services are creating it or destroying it. If you would like to learn more about how to measure and trade in emotional currency, contact Georgina for a discussion about how to make this change happen in your area.